Hi, my name is Sally, and I have our live dog Cooper here with my restrainer, or his restrainer I should say, Eileen. And we're going to demonstrate anal gland expression, but first I'm going to show you how to do this on a model, and then we will actually do it on Cooper here. Okay, so this is our model, and as you may recall, the anal glands are the scent glands for the animal. You can think of your skunk spraying that nasty material. This is what we're going to be expressing out of our cats and dogs. Quite often, dogs in particular will show signs of licking or scooting across the ground, indicating that these sacs are full of fluid. And it's very uncomfortable, as you can imagine. And they need to be periodically expressed. Most animals will do this on their own, but sometimes for whatever reason, they do get blocked and aren't able to express themselves. So they need assistance from us. Cats, the material tends to be quite thick and pasty. Dogs, it does tend to be a little more runny, but it also can be pasty. And one thing that you want to look for in the material is the consistency, and make a note of that in the record. If it's yellow, gooey, pussy, that may indicate that there's infection going on. You can take some of that material, put it on a slide, and examine that under the microscope, and proceed then possibly with flushing of the sac and even introducing some antibiotic ointment into the sac and putting the animal on oral antibiotics. Tends to clear up that type of an infection. Sometimes the glands will get so full they'll actually rupture. So sometimes owners will call and say that their animal has some bloody sore or mess underneath their tail, and that could be a ruptured anal sac. So you want to make sure that they get in to see you as soon as possible for that. On our model here, you'll note that the sacs are located at about 4 and 8 o'clock. On our photo here, you can see 4 and 8 o'clock. They're inside the rectum. So I will put on a glove and some lube and go in with my finger to express these. On our model here, this is just an ultrasound gel that's in here, and I'm going to poke it to create a duct with a needle here so that you can see kind of the motion that I'm going to use when expressing. So I won't put a glove on for this because it's not noxious material. So I insert a gloved, lubed finger into the rectum, and I'm going to reach cranially and then just sort of milk this sac gently with my thumb on the wall of the rectum. And as you can see, I'm getting some pus-like or some material out. I'm going to have a gauze square in my hand or a towel of some sort to collect this debris, because as you know, or will discover, it is nasty smelling stuff. Again, it's their scent glands, so it's their way of marking their territory and letting everybody know who they are. So I'm using gentle pressure and kind of going cranial and caudally and sort of milking that fluid out until the sac is empty. So let's do this on Cooper. Okay, so I have Cooper in a standing position. With cats or smaller dogs, sometimes just having them sit on the table is fine as well, whatever position they're most comfortable in. I have Eileen restraining Cooper because this is probably not the most comfortable situation to be in, and I do want to let her know when I enter the rectum so that she's aware. I have exam gloves on, and I have lubed up a finger, and I have some gauze in the palm of my hand to collect this debris. So I'm going to lift his tail. Sometimes you can actually see some pooching, I call it, along at the 4 and 8 o'clock position if they're really full. Again, you want to look and make sure that they have not ruptured, that there isn't any sore there. And now I'm going to enter. It's okay, bud. I know. It's okay. Good boy. And I have my thumb along the wall of the rectum, and I can feel kind of a full sac, almost like a grape. And I'm going to just gently squeeze and milk that material out. I'm not sure how much of this you're going to be able to see. Notice that I'm standing to the side. You do not want to be directly behind the animal when you're doing this. These can have a tendency to, I know, I'm almost done, bud. Good boy. Good boy. You can see these do sometimes have a tendency to squirt, especially if your finger is over the duct. Quite often I like to pull the rectum down a little bit if I'm having difficulty, and you can actually see the hole or that duct opening in the tissue of the rectum. You want to make sure your finger isn't over that, otherwise there won't be room for the material to come out. I am then going to just rotate my palm and squeeze the other side. Good boy, almost done, almost done. And if you need to have a drip on the table or something like that, you can always clean it up later. I'm going to remove, there we go, that. I'm going to get some clean gauze. Yeah, good boy. And this is stinky stuff. So what I'm going to do is, I've noticed that the material is normal in consistency. It's just a brown, runny debris, not concerned about any infection. And now I'm going to take, good boy, Coop. I'm going to take my icky gauze or towel, and I'm going to pull the glove over this. Yeah, that's you, buddy. And I'm going to twist the glove so that it's not stinking up the hospital. I'll put this in, most clinics will have a fecal container or garbage specifically designed for stinky stuff. And then I'll take my other glove off and pull that over it, and again twist so that we're not stinking up the place, and dispose of this properly. Good boy, Cooper, you should feel better now. And that concludes anal gland expression.